Hi everyone. In this video, we're going to go over how to use custom code categories along with unscheduled treatment. All right. First, you want to make sure you're on the settings page. And when you come to the settings page, you want to make sure you're on the unscheduled treatment tab. All right. Because you have a bunch of other tabs, recall, aging, broken appointments, etc. So you want to make sure you are on the unscheduled treatment tab. Right. So if you scroll down, you will see this section called custom code categories. What these are, they're literally, you can call them tags as well. You can create any arbitrary sort of tags or custom code categories where, for example, you have fillings or inserts or denture. Like in the example on the screen you're seeing, I've created a bunch of codes and tagged them with, custom category named inserts. And I have few for denture. You may create, for example, let's say I wanted to create one for just fillings. Basically, this will have all codes that are related to composite fillings, for example, that you do in your practice. So the way you could do that is you could manually select it. Let's say if you know composite, you can just start typing it in. But one thing you notice, you can either select it one by one. Okay, you can do it that way. All right. But instead, there is a better way to do it. What you can do, if you know that all composite restoration codes start with 2, 3, for example, you can just type in D23 or D2 star. But what you have is D23. If you hit the wildcard character, we call it a star. What it does is selects all the procedure codes that start with 2, 3. That should cover majority of them. So for example, however, you want to make sure they are the codes you want. So if I were to scroll down to D2, 3 area, these are the ones that are selected. Like for example, the ones that are not selected are going to appear in green, which means you can still select them. The ones you have already selected will be gray, and they will appear red when you mouse over them, which means you can delete it, right? You can unselect it. So for example, I've got resin-based composite 1 surface, 2 surface, anterior 3, 4, 2, 3. Now I know resin-based composite crown. That's if you want that included. If you don't want it included, just hit the, select it again and it'll disappear. All right. So if I go down again, let's say 2 surface, I've got 3 surface, et cetera, et cetera. Anything you don't want selected, you just select it again, it'll unselect it. All right. So what this does is I've now created a custom category or tag called fillings, and it includes all of these codes. All right. I'll get to how to actually use this in a minute. Let's just create one more, and you can add as many as you want. Let's say scalings. Okay. Any scalings that you may do in your practice. So let's say I know that they start mostly with 4-3-4-1, which is full quad of scaling root planing, or 4-3-4-2, which may be 2 to 3 teeth, whatever that is. 4-3, and I'm just going to hit star. Let's see what it comes up with. Okay, it's selected bunch for me already, so I'm going to just scroll to the 4-3 area. Okay, so provisional splinting, I don't really care for that, so I'm going to unselect it. Okay, what else? I don't want this one. I just want 4-3-4-1, 4-3-4-2. What else does it have? Technically, I don't really need the other ones. If you want it, you could leave it on there. Okay, I'm just trying to show you how to best use this. Okay, so 4-3-4-1, 4-3-4-2, that includes any sort of scalings, periodontal treatment you may be treatment planning in your practice. Okay, when you've created these, right, you could first thing you want to do is just go ahead and save. Okay, so you want to make sure these are saved away, because if you walk away from this page, you will lose the work of whatever you created here. Okay. I will come back to this section in just a second. All right, so now that you've created these custom code categories or tags, let's go ahead over to Unscheduled Treatment page and show you how to use it. So let's say you're here, you're looking at a list of patients. You're looking at a list of patients, for example. Now you actually want to be able to filter through them. So you want to be able to pay attention to this section here. Under codes, you can either include codes that you want to have appear here or exclude. All right, so that's the first thing. So I want to make sure let's just say exclude. Okay, I don't want certain patients on this list. And then here you see, if you've got custom tags created, you will see them here. So select custom tags. If you scroll down, you will see them. These are the ones we just created: inserts, denture, fillings, and scalings. Let's say I don't want any inserts. Okay, so if I select that, it will select all the codes that I've saved away for that tag. It'll automatically insert it here. Select procedure codes. Remember, before this functionality, we had to manually add these codes in here. Okay, and then now if you hit apply filters, it would exclude those codes. One thing to keep in mind is, for example, let's pick a code 4119, whatever that is. If you exclude that code, the only way that patient will be excluded from you seeing this patient on this list if that's the only code you see on their treatment plan, right? And you don't care to see that because you're excluding it. But what if the patient had 5 fillings on their treatment plan and this code? And even though you still got it in the exclude, if you hit apply filter, it's still going to show up on this list because the patient's got 5 fillings on their treatment plan, which are not scheduled. And if they're not scheduled, they will show up on this list, which is exactly how it should be. So you want to be aware of exactly what you're looking at. What it really does, it exclude means, hey, show me patients where these are the only things on their treatment plan. All right. If only thing on their treatment plan is 44118, it's a non-diagnostic code. I don't care to see that patient on this list because it's an insert code. Okay. All right. So make sure you look at what you're searching for. All right. Let's head over back to the settings page, for example. All right. Let's head over there. Now I want to be back. By default, you end up on the recall tab. So just head over to Unscheduled Treatment tab. And the other way to use it, so now that I've got these custom tags created, if you scroll to the bottom here, codes to include, right? Now we've added these tags here as well. So, hey, wait a minute. So I actually just want to make sure that codes to exclude, there's tons of code that I actually want to exclude. I don't want to include things like inserts. If I just click on it, boom, it selects all the codes that I've already created at the top in that tab, okay? I actually want to include other ones that I haven't created a custom tag for. Maybe let's just say custom tray, or maybe a wax try-in, or whatever that may be, okay? And maybe I want to go ahead and enter 5 or 6 other codes in there. A note, I don't know, next appointment. These are all custom codes that you don't care to see. Okay, so I've created custom codes to exclude, all right? Save unscheduled treatment setting. Remember to always save. Now, if I head over back to unscheduled treatment, right? Now, if I go to exclude, always the first step, if you're filtering by procedure codes, is to make sure you want to include or exclude. So here I want to exclude. And now instead of going to custom tags, I'm going to go here, select procedure codes, but I don't want to type them in. I already have them saved away. So I always, by default, I'm going to hit this button. It says load saved procedure codes. If I hit that, it's going to basically select all the codes that I'm by default excluding in my settings. Okay, so it's a quick way for you to enter codes. Now, why is this important? Let's say you walk away from this page, right? Let's say you hit apply filters and whatever search result came up, and now you want to search for something else. Or you walk away from this page, for example, here, let's head over to recall, and now you come back to unscheduled treatment. Notice what happens. You kind of have to start over. You have to put everything in again. So by default, if you created something, I can just hit this arrow. It says load my saved procedure docs. It'll add them in here. Okay, and now, so we're trying to add custom things to add speed to your workflow to make you more efficient. Okay, so I hope this was helpful. And always remember the the wildcard entry is available for, let's head over back to settings. I'm actually gonna show you what can happen with custom when you're trying to do, let's say D1 star, okay? Not that you're gonna select this code, but what if you did this by mistake, okay? Well, if you haven't done too much other work, you can either refresh the page, it'll disappear because you haven't saved it yet, okay? Let's head over back to unscheduled treatment. All right, let's say I typed in D1 star. Let's say I wanna keep all those codes, okay? But you wanna make sure you get rid of the D1 star there. So if you just click out of the box, it'll get rid of it, and now we'll just have the codes, all right? So I hope this was helpful. And if there's any questions, you guys know where to reach us at nile@teamio.app.